Firstly, I'd like to introduce Zhihong Gu, who is the Program Manager for the HIV, Hepatitis and Sexual Health Program at the Ethnic Communities Council of Queensland. She's been in the role for more than 10 years, working with a range of culturally and linguistically diverse communities. Zhihong has a bachelor degree in preventive medicine from China and master's degree in public health from Australia. Thank you.
Which one is that one? Okay. Thank you, Rachel, and thank you, for everyone to be here. Okay, so I'll be very quick. Okay, so ECCQ, probably some of you already heard about it as a not-for-profit community organization. We provide a range of services. Aged care services, home care and residential care, multicultural programs like training for community leaders and job seekers, and community health programs. So we have two community health programs. Is one chronic disease program, and one is our program, Hepatitis, HIV, Sexual Health Program. So our program is statewide. It's funded by Queensland Health. So we cover viral hepatitis, HIV, and STIs, and it's very stigmatized diseases, so it's very hard to work in the communities. We provide free information and community education in different languages, of course sometimes in English, but most of the time in community languages. And we have resources in different languages as well, and English. And we do provide the support to the individuals and their families, but it's about hepatitis, so QPP does, HIV support. But we do provide support to families and the individuals if they have co-infections, hepatitis B and HIV. We do FAB scans, so I'm not sure if you heard about FAB scan. It's kind of a test for liver, cirrhosis and fibrosis. It's free services as well. For everyone, but it's only in Southeast Queensland. Okay, so HIV services, we do community education. We talk to groups and families and individuals. The problem is that, the stigma is a big thing and people are not interested, and I think it's ignorance, doesn't mean they know everything. But if we talk to people, they said, oh, we know HIV, especially people from African communities, they said we know, but lots of misinformation there, and also they don't have updated, the information about the HIV treatment and all these things, and of course, prevention. So we do provide information through the phone. So we have a number of, bilingual community health workers speaking different languages. So they can call our workers through the phone or email or even social media, send them messages. I think we actually receive more phone calls about HIV and STI compared to face-to-face workshops. People probably like to talk on the phone rather than face-to-face. We do have HIV resources, simple languages, easy to read, and we have HIV and AIDS fact sheet in A4 size. We are going to convert to DL size because doctors said they don't have space in the clinic to put the information there, and flyers. Actually, I didn't put another resource here. It's called Let's Talk About It. So that's combined hepatitis, HIV, and STIs in one booklet. I think it's quite good information because some migrants and refugees, they don't read English, but they said that we want to take copies to my children, and they do read it. So we heard some feedbacks from people actually reading our workers because they read this booklet. So that's easy to read as well. We have condom packs that's free as well. So I'll have these resources all set of the table if you want to take some of these. So the condom packs are very different because we have 3 sizes in a pack. People do need different size, okay? And so we give to them before they use. We said, okay, try which size is best for you, and then you can buy from supermarket or can ask us. And we do have information on the pack as well. Tell them how to use it. lots of people don't know how to use it, and where they can buy them from, and how you store the the condoms. So it's some good information on the pack, so they can read it before they use it. And I think that more young people actually ask for condoms rather than, of course, adults or older people. So they're all free. Okay, that's how bilingual workers actually work in the community. So we know that language is a big barrier for people to access information. Okay, referrals. So anyone can make a referral to our services, either for education or support for people with co-infections. We do like support. We do is occasionally we have a co-infection. The client, or we do have a number of people with hepatitis B. Majority of them are hepatitis B. So we do, help them to understand the letters from hospitals, remind them medications, remind them, appointments, and emotional support. Sometimes, they just need to talk to someone. You can also email me. You can get the form from our website, or you can just email me, health@eccq.com.au. And that's our resources. We are developing more, translating more languages. So that's current ones. So we have order form on our website. If you're interested in anything, you can just download from website or just email me. That's easy. Okay, that's it. Thank you.